Hi, I'm Dara Steinberg.
And I'm Nicole Schneider.
We're excited to be co-chairing the CL-SIG during its 10th year anniversary. The SIG has served as a place of collaboration and mentorship throughout the country.
In honor of this very exciting milestone, we've asked trailblazers in the field and past CL-SIG co-chairs to talk about their experiences in pediatric CL psychology. We hope you enjoy the following video as much as we have, and a big thank you to Brian Carter for putting this together. Thank you so much to all of you for being a part of this wonderful community, and happy birthday to the CL-SIG.
Hi, it's Suzanne Thompson from St. Louis Children's Hospital, wishing the CNL-SIG a happy anniversary. It's hard to believe it was 10 years ago when we first got together. We were driven by the sense that it would be more fun to pool our ideas, and that's what we did. At that SPP meeting, we did a lot of brainstorming. It was just a real sense of enthusiasm and excitement that we could develop initiatives to make things better, improve patient outcomes for our hospitalized patients, and our collaborations with multidisciplinary colleagues across a wide range of medical conditions. And out of that has grown the resource bank and this truly impressive list of accomplishments. Congratulations, and it's exciting to think about what the next 10 years will bring. Enjoy the conference.
Hey, CL-SIG family. It's Dr. Chris Colgren here from the University of Michigan, Mott Children's Hospital. Excited to be checking in as we are celebrating our 10th anniversary of the CL-SIG. It seems like it was not that long ago when we had the idea to come together as a group in a more formal manner, and so proud of how this organization has grown throughout the last 10 years. A lot of challenges though in terms of our practice, our research, and the biggest challenge that we face is the fact that we're CL psychologists, right? That, if it wasn't for what we did, we wouldn't be so busy. And if we were less busy, we could do more research and program development and those sorts of things. So I think the fact that we have done as much as we have and advanced as much as we have as a field in the last 10 years is really a testament to all of you and those who are interested and committed to do this work. I think how we have grown the most in the last 10 years has really been in terms of scholarship. That prior to about 10 years ago, there were only a few people who were publishing in the field. And now we have a clinical handbook, we have lots of case studies, research studies now, which are looking at our clinical practice. And this continues to be an area of significant growth in the field, and where I think we as CL psychologists can really continue to grow and show our worth through scholarship and other types of research. We're also really strong in our training. We're one of the largest SIGs, largely because we have so much interest and so much support from our trainees. And I think we have a lot to offer the folks who want to learn about consultation psychology. So enjoy the celebration, keep working hard in the field, publish, promote what we do, and looking forward to hopefully seeing everybody virtually at the conference. Take care. Bye-bye.
Hi, my name is Brenda Bursch, and I direct the Pediatric Psychology Consultation-Liaison Service at UCLA Mattel Children's Hospital in Los Angeles, where I've been on service continuously for 30 years. When I think back over that time, I can't help but remember around 20 years ago when I first suggested that we add an internship track specializing in PCL. My colleagues thought I was crazy. They thought I was the only odd one that was interested in working with medically ill kids, and they were very worried that we would not match. I had to convince them that there were others of us out there and that we would attract people to train at UCLA in this track. So it's been very gratifying since that time to not only match incredibly well every year, but also just to see how our field has exploded. I never imagined I'd see the training opportunities and the jobs that now come through our listserv almost every day. And to see the development of best practices, the advocacy work, the research, the excellent training that we provide, it's just been amazing. I'm so lucky that I got to see really the development of our field. So, the SIG is 10 years old, and happy birthday. It's funny to be asked what the biggest challenge over the last 10 years has been, given the fact that we are still in the middle of a pandemic. So nothing quite beats that. But if I put that aside and just think about CL itself, I think probably we will all agree that our biggest challenge is to help communicate and demonstrate through our research the great work that we do. We have a unique skill set that the pediatricians recognize, but the hospital administrators and insurance companies and others who make some of those financial decisions don't always have all that information. And we have more work to do on the research side to demonstrate it as well. So I think that will be our challenge. I think that is our main challenge. And I think we're up to it. So I was optimistic about our internship track, attracting top-notch people. And I am optimistic that as a profession, we will be able to do this as well. When I think back at what has been the thing that has brought me the most joy in my job, it really has been working with my PCL interns. They're each so amazing in unique ways, and I consider all of them family members. I'm in close contact with nearly all of them. And it's really hard for me to explain how much they have enhanced my job and my life. Nothing has really come close to that. When I think about the many, many things that I love about my job, that is really my favorite. So if you are just starting out, I'm very excited for you. You have picked a wonderful field, and you're going to really have an amazing career, especially if you end up having the opportunity to work with trainees like I've been able to do. My advice to you is to say yes to things that sound like fun, even if they don't fit what you thought your career trajectory was going to be. There's going to be surprises, and just follow your nose and go where sounds good to go at the moment. And then when you find yourself in situations like we all do that aren't good for you, try to get out of those as soon as you can. Take some actions when you have that opportunity to make a move that will make you feel better about what you're doing, and in a situation it's just a better fit for you. And boldly be you. We're unique individuals that like to do this work, and I think we serve everybody best when we really lean into what we do, and we're not afraid to speak up when it's indicated. So I hope that for you. I know I had to learn how to become much more assertive, which I think now surprises everybody because I'm pretty assertive. Anyway, so best wishes to you in your career, and best wishes to the next 10 years of the CL SIG. Happy birthday.
Hi, I'm Courtney Fleischer, lead inpatient pediatric psychologist at the University of Vermont Medical Center and a former co-chair of the CL SIG. And I'm happy today to be responding to questions that were posed about our field over the past 10 years. So the first question, what have been the biggest challenges of the last 10 years? So in small, rural, and largely homogeneously white patient populations like the one that I've served over the past 10 years, I find a couple of challenges that are related that stand out to me. So first, like many of you, I wear many hats as a psychologist, and in smaller and rural settings, That oftentimes results in having divided time between outpatient and consultation responsibilities, which can really slow down the process of building programs and practices. And so the patient populations that I serve don't always have access to the type of cutting edge interventions that they really deserve. And relatedly, provider and staff expectations about behaviors tend to be Eurocentric. I know that that's true in many settings, and particularly so in smaller and rural environments. And as we recognize that our communities are and are becoming more culturally diverse, understanding and acceptance of culturally different parenting practices and values has kind of lagged behind. So when behavior and values of patients and families fall outside of the established norms, biases can really get activated and can interfere with the patient-family-provider relationships. So I find myself balancing helping these families feel heard and also helping providers to engage in culturally humble practices. And compared to navigating the impact of race and culture in the outpatient setting, I find that in the inpatient setting, it's really intensified. The challenge is really intensified, as it's not just our own individual relationships with the patients and families, but we're experienced as part of the system that's inflicting the pain on families with diverse identities. And I find that to be particularly challenging. The second question was, what have been the best advancements and growth areas in the last 10 years? So I would say that the development and sharing of resources about applying best practices in the CL setting has really blossomed over the past decade. And these resources have been collated online through condition-specific websites, the CL Practitioner Resource Bank, and last year's publication of the Clinical Handbook of Psychological Consultation in Medical Settings. And in addition to these resources, like directly connecting with colleagues that you might meet through the SIG allows people opportunities to shape the wheel to work in their setting rather than reinventing it each time new practices need to be put into place in hospital settings. The last question is, where do you see the field going in the next 10 years? Well, we know that over the last few years, increasing numbers of patients have been boarding in emergency departments waiting for psychiatric beds, and our pediatric medical colleagues have been taking care of these patients in crisis. Our hospital found that during COVID, the percentage of patients admitted with complex social situations and mental health concerns expanded exponentially, and more patients needing medical care following suicide attempts and self-harm behavior are also being cared for in our hospitals. So the needs are just exceeding the resources. When this happened in the outpatient setting, PCPs and their staff adapted and began caring for the emotional and behavioral health of their patient population. And so it seems like at this point, our hospitals, house staff, and other carers are going to start to need to incorporate aspects of our skill base into their practice as well, as there's just not enough of us to take care of these patients individually. So adapting and teaching aspects of the work that we do to people who are spending the most time with hospitalized patients with complex behavioral and emotional needs just seems like an area that's ripe for development at this time in history.
Hi everyone, I'm Dr. Kevin Sang, pediatric psychologist at Boston Children's Hospital and Harvard Medical School. Thanks for this opportunity to contribute to this video and reflect a bit on how our work has changed over the years. I'm grateful for everyone I've met and had the opportunity to collaborate with during my time with the CL SIG and its leadership. Also, congratulations to the SIG for making it through 10 years. You're now old enough to be considered mid-career. In terms of the biggest challenges of the last 10 years, as is often the case, it comes down to time and money. CL psychologists are often a consistently busy group, whether defying physics so we can be in 2 care settings at once, navigating the nuances of systems and interprofessional teams, or skillfully implementing empirically supported interventions in novel settings. I imagine the impact of this past year has only kept us all busier than ever, extending our creativity and clinical decision-making in profound new ways as we work together in our hospital settings to meet mental health needs throughout the pandemic. Although these efforts highlight the value we contribute as consultants, it also further shows where staffing levels and reimbursement can be improved to allow for more proactive and sustainable psychological care. While each CL service is built a bit differently, a common need remains for bringing reimbursement and budgets to the level of true health parity. As for the best areas of growth over the past 10 years, although we continue to face challenges related to program development, CL psychologists are certainly tenacious and savvy, continuing to develop new programs at different hospitals, build relationships with key shareholders, and develop our value and worth beyond dollars. In the past 10 years, this CL SIG has continued to grow, contributing to research, clinical innovation, and mentorship. These efforts have afforded us the opportunity to see different generations of CL psychologists come into their prime, from fledgling programs to impactful clinical teams, improving the health and well-being of patients throughout the country while reducing misconceptions and stigma against mental health through these partnerships. In terms of where the field is going, over the next 10 years, members of the CL SIG and consultation psychologists in general have a unique vantage point to support healthcare equity. As often embedded providers working shoulder to shoulder with our medical colleagues, CL psychologists are already accustomed to translating the science of psychology in empirically supported intervention. This same skill set is essential in driving social change as we support an ongoing paradigm shift in how healthcare as a whole is delivered to patients with varying and different backgrounds and disease processes. The strong contingent of trainees in the CL SIG each represent potential agents of change in shaping the future of not only CL psychology, but also clinical practice across the board. I can't wait to see what happens next in this field, but I'm certain that the ongoing contributions of the CL SIG will continue to steadily shape and support along the way. I also can't wait to see everyone in person soon, and in the meantime, wish you all well.
I'm Dr. Brian Carter. I'm a pediatric psychologist and a professor of pediatrics at the University of Louisville School of Medicine. It was 10 years ago that Suzanne Thompson at St. Louis Children's Hospital and myself chaired the first special interest group meetings, and quite honestly, it was Suzanne's encouragement, I should say dragging me to it, to get me to agree to do this. But it has been a delight to see the group grow and accomplish some of the goals that we set that whole decade ago. Seems like yesterday. One of our meetings, I remember in San Antonio, we actually set a number of goals for the SIG. And some of those goals were really to create more resources and more connections between consult liaison pediatric psychologists in different hospital settings. Some of the first meetings were sitting around asking about what's your billing model? How many people are on your service? How do you rotate attending coverage on your service? A lot of nuts and bolts kind of questions just about how CL services are structured. The manpower, were we in psychiatry and pediatrics? Were we psychology alone? We were paired with psychiatry, etc. And we learned a lot from one another. One thing we learned is probably no two CL services are exactly alike. Some CL services are relatively small, even single psychologist operations, and others have a subspecialty psychologist in virtually every subspecialty area of pediatrics. So a lot of that learning, I think, went on at those meetings, and after, between meetings, went on in terms of helping us help one another out and constructing our services. Some of the goals we set at those first meetings were, one was to create an online resource for pediatric psychologists. And several years ago, we actually created what we call the Pediatric Psychology Resource Bank website. If you don't subscribe to that, send myself an email. Myself and Dr. Katie Schwarzkopf at Riley Children's Hospital at Indiana University actually both manage that website. And we're excited to continue to add more and more resources for assessment, for practice, for intervention, for education that pediatric psychologists can use and share with one another. Another goal we had was the Handbook of Pediatric Psychology was around probably at that time in its 4th edition. And we wanted to make sure that we continued to contribute to the literature on consultation liaison, both in the handbook And then we said we really need a very kind of clinician-friendly resource. I'm happy to inform you that that goal was realized last year when we published the Clinical Handbook of Psychological Consultation in Pediatric Medical Settings. It's a real mouthful, with Springer Press. Chris Colgren at C.S. Mott Children's Hospital was my co-editor, and the series is edited by Dr. Michael Roberts, so a big friend of pediatric psychology, obviously, and we feel like the clinical handbook is a great companion volume to go along with the Handbook of Pediatric Psychology for busy pediatric psychologists and CL psychologists. So that was another goal that we kind of planned and we'd realized. Share resources. We've had collaborative projects that have come out of things such as the pandemic. The CL leadership actually at the beginning of the pandemic created a couple of projects that really looked at how are our practices changing during this time of the pandemic, and how are those adaptations likely to facilitate the work we do in the future. And a couple of these projects have now, one's been published in the Clinical Practice Journal and another one's under review. So we have a number of things that have just come out of that excitement, that energy that exists with the leadership. I think that going forward, pediatric psychology in hospital settings and inpatient settings, as well as specialty clinics and so on, is just only going to grow. There's going to be more and more demand for it. So the SIG, along with all the other SIGs in Division 54, are going to be very busy kind of meeting those needs of the practitioners, of the researchers, of those working to meet the needs of our medical professionals and our patients and families. So get involved. If you're not a member of the CL SIG, we'd love to have you join us. If you're not a subscriber to the Resource Bank website, let me know, and I'll put my email address along with this message. And get to know your colleagues. I can't wait until we can see each other in person next year. It has to happen. Virtual has been a nice stopgap, but it's not the same as meeting with your colleagues for breakfast, during breaks between sessions, etc. That camaraderie and way of catching up with each other, there's no substitute for it.